guys, we are back. How you doing, Elsa?
Great.
Just great.
Yeah, I haven't been doing anything. I was I was making fun of you and say, you have to write down what you've been up to, but I literally haven't been doing anything.
Really?
I've ghosted everyone.
Oh,
I
love that.
I did. I ghosted everybody.
The friend cleanse or like just
all
like,
of it.
Oh, no.
And restarted.
I love that.
Yeah.
You know what? I have been doing that like recently with like the guys that have been trying to date me recently, I've been talking about them on the podcast a little bit.
Embarrassing.
They're all with someone now. No, like, and then I tried reaching out because like there's been such a build up of us talking about like, I should just do it or like date that nice person that's totally available and really into you. And I'm like, and then finally getting around to it, I'm like, I'm going to have a second look. And then as I go down the line, all three of them, dating someone
All
down,
three?
dating.
Wow.
Yeah, I know.
Hey, you know what I like about that though? Usually people would lie and be like, yeah, maybe I'll go out with you. But I like that all three of those people were like, no, I am seeing somebody. Because actually most people don't do that.
Keeping their options open, right?
Or they'll just not answer. So I kind of like that they...
Well, getting back to the friends thing though of that is that I actually then decided, well, there was one of them, and you can tell me your thoughts on this, but like one of them was like, we should go out like as friends and like hang out or whatever. And I'm like, you know what? I do need some more gay friends. Like I need to actually have, outside of me going across the road to Holly's.
I know.
And like that's all I do. I'm like, as an adult, like how am I going to find new friends if I'm not going out? And like, you know, like I should have other, and he's my age, this guy that lives in the building across the road that I made out with. He doesn't listen to this. Anyway, so I went on the weekend and like went out and like it was such a nice thing. It was like totally, it was even better that he had a boyfriend because like I actually had an available gay male friend that's exactly my age, and we've been chatting about like doing more things and like just introducing me to his other friends. Is like, we'll go to movies and like really cute
I'm
shit.
I'm happy for you. You need that.
Yeah, so I didn't think friend dating, like dating your friends.
I switched my Raya to women that want friends. And I was like, and I was like, wow, these are girls that are more like me, because remember I was having trouble finding friends that were like similar to me, and all the girls are just, you know.
That's such a, I love that for you. Like what kind of caliber friends do you get on there? Because at least they can keep up. Like they're all people that are like in an industry and have that like,
just can understand. Yeah.
No, I like that. Oh God!
So
if only I wasn't on the waiting list.
Yeah,
Still not cool
you're
enough
on the waiting list. You have a Raya?
No, I never got let in on Raya.
Unfortunately.
I know. I was on the waiting list forever. I just gave up.
Oh, God. Me too. That is totally my thing. Well, if you haven't realized already, we have the beautiful Dr. Gonzalez. Sorry, I'm already like soliciting you. That is not.
By the way, I'll be your
You
gay
are
friend.
very beautiful.
I'm happy to be your gay friend if you need one.
Oh, yeah.
Oh my God. He really does.
See, I'm changing the story in my mind of what it like is that I'm looking for. Because like I obviously wasn't ready to date. And I'm like, why don't I date? I'm such a like weirdo. But it's like, I think I just need to make myself available to friends. As an adult, when you're not at school, how do you make adult friends? Like you don't really go out, especially when you go out drinking or whatever. It's like you see them that night and then you're never calling them again. That was a party night. You're all out or like trying to have sex or whatever.
Right.
Anyway, Joshua Gonzalez, MD, is a board certified and fellowship trained urologist and sexual medicine specialist who focuses on managing sexual dysfunctions in men and women. He's also invested in advanced medical technology, ensuring the highest quality treatment with an overall goal of helping patients restore their vitality and regain control over their sexual function.
That's it.
That is so impressive.
Thank you.
You really recovered there. It was at first.
Doctor.
At first I was like, oh, should I start reading it?
I'm always eating my words. How are you?
I'm great. How are you guys?
Really good. We're really excited to have you because we want people that can give us like actual facts and like medical, advice, because we're always just trying to give people advice just from like, you know,
your experience,
just my experience and his experience. So it's going to be fun to help these people with some good.
It's fun, right?
Use me as an expert.
Yes, we're so excited.
We were secretly gagging because we were like, oh my God, the stories that you would have about like what people come into your doctor surgery for, or like, oh my God, we'll get to that.
Okay.
How did you choose to go into urology? Or just sexual dysfunction? Or?
Yeah, that's a good question. So we have to, a little bit of background with medical education. In med school, you have to choose a specialty based on kind of rotations that you do. I was actually drawn to urology because of the people that I interacted with. It's a surgical subspecialty. Surgery can be very intense. There's a lot of intense personalities that I didn't really vibe with. And urology, for whatever reason, I think it has a lot to do with the body parts that we, are taking care of. We can't really take ourselves too seriously, and you have to have sort of a good way of interacting with people because you have to talk to them about very literal private parts.
Yeah.
And so I think it attracts a different kind of personality, and I just vibed with that kind of personality a lot more. And then I went into urology residency and just really liked sexual health. I thought I could make a really big difference in someone's life, without necessarily needing to cure cancer, but
Absolutely.
really have a positive effect on their quality of life. And so, that's kind of how I ended up here.
It's so important. Sex is it is like one of the number one things for people,
everything
and
is driven by that.
Yeah, but no one talks about it, right?
Yeah,
that's the crazy part, is that it's such an important, like if you talk to an individual person and ask them about it, yes, it's a super important part of their life. And we all interact with it in media, in porn, like it's all over the place, but no one's having those conversations, especially in medicine, asking people proactively, like, how's your sex life? Could things be better? What would you like to improve?
We've talked about that before, the shame that goes around it. Like, where did it come? Like, we've gotten into like where it comes from and why people are so shameful of their body parts or of sex in general. Like, it's just conditioned into us over many generations. I think it's becoming more free now.
Yeah, absolutely.
But having those conversations, that's some of the most popular. Even other podcasts, like, there's sexual like influencers like Call Her Daddy and things like that. It's all been women relating to each other or men relating to each other, actually just having open conversations going, what, we were all thinking the same thing. And we weren't talking about it. We would have saved so much time and had such deeper connections if we were able to just because weirdos thought, I guess from like religion or whatever, was like, oh no, you can't masturbate or like have sex with someone because that's dirty.
Well, and our sex education, at least in this country, that's the only thing I can speak to, is terrible, right? We don't teach young people about how to have sex, how to have safe sex, how to have pleasurable sex. We really, even if you have sex education, it's really about how to not get pregnant, how to not get an STD. There's never a conversation around pleasure, right? And that's why we all do sex. So, it's a shame, but I think that's part of it. It's I think a cultural stigma, but also just a lack of education.
Yeah.
Another thing that is a big thing is not realizing, I think, men have infertility too, and a lot of people always just automatically assume that it's a female. I don't think a lot of men also understand how to keep their sperm healthy and like keep their a lot of people struggle with erectile dysfunction and
that's a good point. And men being as accountable as women, because women actually go into the gynecologist and things like that and they're more well versed with it. Yeah.
I get that a lot in my practice. I see about 60% male to 40% female in my practice. But most of the men that are coming to see me, they've waited 5, sometimes 10 years before they're seeing someone about erectile dysfunction. And you wonder, like, how have they been existing this long, not having talked about this problem? But I think women from a young age are taught to go to a gynecologist for just general health. And so they're more used to having, exams on a regular basis and having conversations that are pertaining to sex, whereas men really only go when they have a problem.
I was talking to my doctor recently. I went in for a visit and I was like, I don't want to, I was like, at what stage should I like check on like down there? I was like, but I'm not taking my pants off. Like, that's not going to be a thing, is there? Like, I'm so nervous. Like, I get it. Like, I would never, I can't even imagine. One time I had a cyst on my butt cheek, right?
Okay.
It was like something. I had to have surgery and have like cut out, but I waited till like it was so far down. And
a lot of people do that. It's scary going to the doctor. Nobody wants to go to the doctors and talk about a problem.
Yeah, especially in this area.
We feel so shameful because everyone just like hides it. Like from the moment you're like, what is it, like 1, and then people start going, put something over it, or like don't show anyone, and that's horrible, or like don't be dirty.
For us women, we have to lay there and completely, they take a thing and open it up completely, and it's like way more.
Women go through a lot more. It's a much more invasive exam.
It hurts too, really bad.
But at least they get it over with at a certain stage, and then like,
you go like every 6 months.
Whereas guys, it's like, it's not a thing. Maybe it should be a thing, but what would
we're going to make it a thing now. We're gonna,
that's my goal, is to really try to normalize all of this, not just sexual health, but if you're having a problem, see someone. Sooner that you see someone, the better you have a chance of fixing the problem,
Right.
Oh, okay. That's good to know.
Yeah.
Like, I wonder what's the leading causes for, erectile dysfunction?
I mean, it depends. Usually I kind of try to break it down for patients in terms of sort of physical versus psychological factors. And a lot of times it's a combination of both. As men age, starting around age 35 or 40, which is pretty early in a man's life. I know. I'm there too, don't worry. But their testosterone starts to naturally decline. Testosterone is a very important hormone for male sexual function in general, specifically erections. And so we see sort of hormone-related erectile dysfunction a lot. Men, as they age as well, this is usually in older men, can develop vascular issues. The penis is a vascular organ. It's part of your cardiovascular system. And so the same way that you develop plaques in your coronary arteries or other parts of your body that limit blood flow, that can happen in the arteries that supply your penis with blood. And so you can have a cardiovascular problem causing erectile dysfunction. So those are two of the most common physical causes.
Do you believe in like hormone replacement then, like for testosterone for men? Do you think that really works, like, and helps?
Absolutely. Yeah. I mean, I think hormone replacement therapy for the right person, depending on what their symptoms are, is super important. Yeah. So in medicine, we don't routinely just screen for low testosterone.
To just look better, because I'm worried about aging now. Like if I have my testosterone replaced, then
why don't you go get those HCG shots? Yeah, or that's what people do to look younger. You know what I'm talking about?
Yeah.
I mean,
I think you should investigate whether your testosterone is a problem if you're having symptoms of low testosterone. But those are, everything from erectile dysfunction to chronic fatigue to difficulty putting on muscle or losing fat despite, eating healthy and exercising, and you're doing all the right things, but you can't seem to get rid of the weight.
I should get my levels checked. That would be interesting to find out. And it's right. It's like the perfect time. Yeah. Like it's not stupid that I would be doing it when I was like in my 20s or whatever. That might have not
I would say the one thing also to keep in mind, and I see this a lot in a lot of my gay male patients too, they go on testosterone replacement, earlier in their mid 30s or whatever.
And then they grow weird hair and stuff.
No. They do fine. They actually look great. They feel great, but it does affect your ability to conceive. So, and a lot of people assume that gay men don't want to have kids, which is a terrible assumption. But when you're on testosterone, you stop producing sperm. And so I always have that conversation with my male patients. And even if it's a possibility 10 years from now that they might want to have kids, I just talk to them about what happens when you go on testosterone and let them know that it could be challenging in the future.
Or maybe save some sperm or something.
Or there's other treatments that we can put people on to stimulate their body to make more testosterone. And that doesn't compromise their fertility. Oh, okay. So for younger men, we kind of
sounds better actually.
Yeah.
To naturally.
I love this so much. Yeah. Let's get to the Heartbreakers hotline and then circle back.
Yeah.
Okay, Heartbreakers. I am a recently divorced 45-year-old male, and the last few years before my wife and I split up was all but sexless. I'm looking to get back into the dating world and work up to being sexually active again, but I'm worried I'm suffering from ED. It's been a problem for a few years now, and a whole other bunch of problems are going to get in the way. I'm going to embarrass myself. How can I get an older guy get himself back in shape in the streets and in the sheets?
It's a great question. So I get this a lot. There's a lot of people who, towards the end of their relationship, probably because they don't have a lot of intimacy with their partners, go for months, years without having sex, and then they end that relationship. They're in a new one, and they're like really stressed out about how they're going to perform with new partners. So I would say, in general, what we tell people to do is whatever's good for your heart is good for your penis. When your doctor tells you to eat a heart-healthy diet, to exercise, 3-4 times a week, to get good sleep, all of those things are really good for your hormone production and for improving blood flow. And those are two key things for getting good erections.
Ooh.
Yeah.
I don't know. I'm getting ideas.
Yeah. So
James, can I announce that James are waiting to have sex, or he's really nervous. Yeah. He lacks the confidence. Remember, not to plug your stuff too early, but remember we were talking about helping people with confidence. Like he really just needs a confidence booster.
Yeah.
I don't know. I think it's like what you were saying at the end of my marriage, like we didn't have sex for many years. So then there was that. And then I got out of the marriage and then still didn't. I think there was one person or two people, but like it was like when I was wasted. So like you don't really remember.
Yeah.
So like for me, it's been like years now since I've had sex.
Yeah. I mean, I would say another thing to well, thank you for being honest about that. That's nice. I think another kind of clue is when people are nervous about their ability to perform is I always ask them what happens when they masturbate, right? Because then you remove that other person, which is the source of anxiety for a lot of people.
Yeah.
And if they're masturbating and not really having a problem, then you know the plumbing's working, right? And then it's just about how can you optimize their ability to perform when it comes down to having sex with somebody else. So in my office, we do, hormonal assessments. We assess patients like erection, blood flow, and make sure that everything in those 2 buckets is optimized. And even if there's nothing wrong in those areas, sometimes I can still provide patients medications that they can take just to get them back in the game. And I often will, normalize it for them and tell them, listen, this seems like mostly an anxiety driven issue. It's totally normal. You haven't had sex in years. You're going to be nervous the first time. Let's put you on this medication. I'm very confident it'll work for you. And then once you start engaging in regular sexual activity again, you'll probably find that you don't need the medication anymore. Especially, there's a lot of people that need to feel comfortable.
Push out the door.
Or they just need to feel comfortable with somebody, right? That once they get into a routine with a new partner, they sort of lose that anxiety. And so it's okay if you need to take some medication to get you to that point.
Right. Good.
I like that. Okay, we have another question. I'm a 24-year-old man and I'm so terrified I'm not big enough. I'm just over 5 inches and I hear everyone obsessing over penis size. So I'm often scared, so often I'm scared to have sex of fear of looking too small.
I get this a lot also. I think, first of all, there's a lot of misunderstanding about what normal penis size is. In this country, 5.5 is average. That's not what we see in porn, right? Everybody in pornography is in pornography because they have a specific talent related to their genitals.
Yes.
And so all of the men in pornography, for the most part, are very well endowed. And so,
don't you think guys on Instagram's dicks have gotten bigger though? Remember when I brought that up? I feel like as a general thing, I'm like,
Jace,
are we
I think it's just the
evolving?
I think it's just the Instagrams you're getting on.
I think there is some evidence that penises are getting bigger over time, but it's.
Is that because they're using them so much more than in the past, and then they have to grow to like?
No, I think it's also a little bit of filtering.
Or penis fillers, which
penis fillers and cock rings. There's a lot of stuff that you can do in the underwear that you're wearing to make your dick look bigger.
God, there's all these cheats. I bet you if we Googled it, there would be this is how to make it look big. Because that's the things that I watch on Instagram. If someone's wearing grey sweatpants and they have a giant dick. I mean, it's just like, it's really basic, but it just appeals to my
it's attractive for sure. But I have some, people that work in the adult industry whose videos I have seen as patients. And sometimes I'm like, oh, it looked bigger on camera. Like, so there's definitely angles and Photoshop and retouching and filtering.
So average size is, what was it?
5.5.
5.5.
And then what about the penis fillers? I want to know, like, I've never heard of this. And he said it's been around for like 2 years.
Yeah. I mean, I think it's probably been around even a little bit longer. We've been doing it in my practice for like 2.5 years, but we basically use the same filler that people use to add volume to their lips and their face. It's hyaluronic acid. Historically, men were going to back alley clinics, going to Mexico and having all kinds of things injected down there, silicone and... Does
it decrease the sensitivity though?
No, it shouldn't. I mean, if done properly, I'm a urologist. I'm very familiar with the penile anatomy. I'm very comfortable doing procedures on the penis. So I think if you're going to someone who knows what they're doing, there really is no risk of decreasing someone's sensitivity. In fact, a lot of our patients will report increased sensitivity because their skin stretches more. They probably are feeling more confident in bed. They're able to enjoy sex more. And so a lot of times it will enhance their sexual pleasure.
How much can you enhance it?
There's really no limit. What I would say is we generally... inject the shaft. We don't do much to the head because the head is mostly spongy tissue. So when you try to inject into it, it doesn't kind of disperse evenly. But that for me is one of the limiting factors, because if you start to increase the size of your shaft
does it just get
and you have a
really
little head, it just starts to
Which
look really
sometimes
weird.
it sometimes happens just naturally. So, you know. Some people,
But I mean, we
You really
can.
need to squeeze the tip and get the blood in there, because then it's not going to match the rest of where you just.
so when someone gets hard, is it gets fully hard?
Yep.
So with the fillers,
Yeah.
and
So I mean, that's a little bit of the art of doing this. I would say, I'm not an injector of lips and faces, so I can't speak to that. But I personally think that it's harder to inject someone's penis than it would be those other areas, because the penis is a dynamic organ, right? So it's always moving, it's changing shape, you're getting harder, you're getting softer, it's retracting because you're cold, or you're at the gym, or you're coming out of the steam room and it's hanging lower. So you have to account for that when you're putting the filler in. But if done well, yes, it should, look bigger when you're flaccid. And in fact, a lot of our guys are really happy because their flaccid penis, when they're just walking around naked, hangs lower. So they become more of like a shower. And they're pretty happy with that. But also when they get aroused and become hard, it also should be bigger.
Yeah.
So, and then the penis implant, that never, if someone gets an implant, it never goes soft, right? Or
No, so there are sort of two style penile implants, mostly for guys who have erectile dysfunction. So when guys have ED and they don't respond to pills, or they don't respond to injections, which is another method that we have to help guys get good erections, we call them medication refractory. And so then we start talking to them about surgical fixes, one of which is the penile implant. And there are two types. One is called a malleable, which is sort of this permanent kind of hard rod that we put in there, and they kind of just bend it and bend it up and down to have sex. So it's sort of like a Gumby dick, right? It's just like posable.
That's probably so bad.
But yeah, it's not ideal, and we honestly don't do them very often unless somebody doesn't
Really
have good dexterity of their hands, or they're really old, they're like in their 80s or something like that, which, good on them if they're still at that age wanting to have sex. Right. But for most men, who have good use of their hands, we put in an inflatable penile implant. So that is 2 cylinders that get hard and soft by cycling fluid in and out of them. And so there's a pump that sits in their scrotum. They reach down into their scrotum, pump it up. It draws fluid into the cylinders. They get hard. They have sex. They ejaculate. Hopefully their partner gets off also. And then the pump has a little release valve that they push, and then the fluid exits the cylinders and they go soft.
I know somebody with that.
Really?
There's people in the adult industry with
absolutely.
that.
Ooh.
Yeah. And it's very interesting.
Different?
No, but I did watch him blow up his dick basically through his balls.
Through
It
his
was
scrotum,
like,
you just have to go.
yeah, it's like,
I mean, the incredible part is, and you can probably attest to this, is that unless someone reaches down there to feel the pump, you actually, if done well, you shouldn't know that they have an implant. Everything is hidden. And when they're soft, it just hangs like a normal flaccid penis would.
it's very interesting. That's very useful for people, I think.
Yeah.
Like, that one sounds really, I mean,
I always tell people when they come in to see me with ED, right? Like, they're always like, do you think you can help me? And I tell them, if you are motivated and you're willing to listen to whatever my recommendation is, you will get an erection one way or the other. It might be pills, it might be injections, it might be surgery, but there's a fix for everybody.
That's good for people to hear, that there really is a fix for women and men.
Yeah, totally. Guys are so obsessed with their dicks.
I know. That's
so this
all
is really
we want to talk
Instagram
about.
gray sweatpants isn't helping.
Oh yeah, totally. No, I'm here for it. I get it. It is weird. Like no other body part. When it's not like thumbs, it's just like
because it feels so good. That's why everybody's so obsessed with it.
Yeah.
Oh god.
Obviously,
we're simple creatures.
Yeah.
We are. We're really just animals.
Monkeys. Yeah, exactly.
Yeah.
Okay. This next one is my boyfriend and I have a great sex life, but every time after we have sex, I'm so sore and feeling like I should kind of have a pre-sex ritual. Do you do anything special when you prep to have sex, just in general? Stretching, breathing, anything in particular? How can I ensure that post-coitus is also pleasurable, not just the coitus?
I have this one. First off, I feel like when you're sore, that is most of the time lack of lube, right? So a lot of people just need lubricant. And then what I really like is this one brand of lube, and it comes in like a syringe. And it's this one, it's for people who are trying to conceive. You can get it at CVS. It's in like a blue box and says like fertility lube, whatever, right?
Yeah.
But it doesn't have a taste or anything. So I'll put it up there if I'm about to go have sex with somebody, and then they'll think that I'm like wet and I won't get sore because it'll just be coming out like during.
And it's a good secret too.
Yes,
You're just like
it is a good
syringing
secret.
it. Like
and it comes with a syringe and everything. You just put
What's
it
it
up
called?
there.
I haven't heard
It's fertility something, and it has 2 people on it, and it's a blue and a white box.
I love that it's available at CVS.
It's at
great.
CVS, and I remember one time I just quickly used it, or I don't know, there maybe was no other lube, and then I put it up there, and it really has no taste, and it like mimics your vagina fluid, so it just
they're like,
it just
you're
is
so
a
wet.
lot. Yeah, it really does mimic it.
Yeah.
So the whole
That's
time,
great.
and it keeps you wet.
Yeah, I mean, I think it's great also too that like stores like CVS and other pharmacies and stuff are carrying more and more. I go in and I'm like, they have vibrators here now. Like, it's nice because I think they're going back to the shame thing. A lot of people don't feel comfortable buying lube because they're like, oh God, I got to go into that like porn store or that adult store to get it, and they don't want to have to deal with that. But if they're just, picking up some paper towels at Target,
Might as well just grab some lube.
Yeah,
I always get my lube from CVS. They really have every brand there too.
I remember a time too where it was like people were like, oh, I'm buying condoms or whatever, but like it really has changed because like it's weird to even think 10 years ago, even though I was younger and whatever, like that it would have been more like secretive or like less product and like what is wrong with us? So crazy to think.
Do you have anything that you would recommend for someone that gets sore?
I think lube saves lives. So I think lubrication is definitely key. I would also say foreplay, right? So, I mean, a lot of people, I don't know, because we're really busy and, you don't think you don't have to time and you're like, I got to get this in, get this out, 5 minutes, just jump to intercourse. And if it's been a while since you've had sex, number one, like you said, natural lubrication may be a problem, but like spend some 5-10 minutes, with oral sex, stimulating someone's clitoris, like those things will naturally help you become more aroused, help your body relax, and will hopefully help prevent discomfort afterward.
Yeah, that's good.
I feel like we're
on
such a mission to get to the end game that like you can really, and that is like a thing. It's like I want to make, even if you're thinking of the other person, like I want to make them come, but it's like you're missing these steps along the way. And like being too projecting.
Yeah, I think also one little secret that, and I use this a lot in my practice, is we have a lot of patients. I treat a lot of women who have pain with sex, and there's a whole host of reasons that can happen: hormonal, psychological trauma stuff, problems with like a tight pelvic floor. And so I refer a lot of my patients to pelvic floor physical therapy, and it's like essentially getting a massage for your pelvic muscles. And it can be incredibly helpful for women who experience pain with sex.
This is legal.
No, these are professional pelvic floor trained physical therapists.
I've never heard of this.
Yeah,
that's really useful for women because it can be very painful for certain women.
Yeah.
Depending on how you're set up, you know?
Do guys have a pelvic floor like that they can actually do like Kegels and stuff? But not Kegels?
Yeah.
So, everyone knows about Kegels, and they can be useful for some men depending on what the problem is.
What problem would they fix?
Sometimes guys, if they're having trouble like maintaining their erection, or older guys, if they're having problems like retaining their urine or something, can do Kegels to strengthen their muscles and help those issues. But what I actually see a lot more of, and this goes back to women who have pain, who have muscle tension, their muscles are super tight. I have a lot of guys in my practice who have super tight pelvic floor muscles, and that can cause problems with their erection because it's not allowing the blood to go into their penis. And we, as a people, don't have good conscious control over those muscles. Like, think about all the things that happen in this area, right? Like erection, ejaculation, urination, bowel movements. We do all of those things without thinking. So those are all like unconscious activities. But when you have a problem in that area, you have to like go to a professional. They have to evaluate it and teach you how to have better control of those muscles. And so male pelvic floor physical therapy helps my guys with ED, with urination, sometimes with ejaculation
How
issues.
do they do it? Like, how does a male do an exercise like that?
Well, you only have one hole. So you can imagine.
Oh, so you just got to you just got to suck in, like you're sucking in air in your bumhole?
No. So I would send
That's
them.
how I was imagining it. 'Cause like sometimes I would do that. I'm like, is this a thing? Okay, I'm not doing that
Sucking in air through the bum hole. How does that work?
I'm touching the starfish.
I mean, I think it depends on what the problem is. So
Yeah.
I rely on my physical therapy colleagues to kind of do their evaluation, but that usually involves them sticking their finger inside you, feeling the muscles, and if they're tight, they're doing the same thing that would a masseuse would do if your shoulder was tight, right? They're manually releasing those muscles and then teaching you how to do stretching and breathing exercises at home to make sure that the muscles don't go back to being too tight. So yeah, it can be really helpful for both men and women.
Wow.
Yeah.
That's what the listeners will be very happy because they're always asking us what they can do.
Yeah.
I know. I'd book an appointment, but I'm too shy.
Go.
Oh my gosh.
James just wants attention. That's why he just wanted attention.
I do. Anyway, I can get it.
I feel like I am the queen of the shit right now. Say my name, say my name, yeah, yeah. Say my name, say my name.
All about Joshua.
Yeah.
Oh
As if
no.
it hasn't been all about Joshua the whole time.
I'm in the hot seat now.
Do you, when you're in the middle of injecting people, or let's say like they come into your practice and you're doing stuff with them, do they ever get erections because you're touching their penis?
Yes,
Yeah, I'm
but
sure.
remember what I do? I focus on sexual health. Most of the guys seeing me have erectile dysfunction. So if
okay,
they're getting hard, there's something suspect about why they're there to see me.
Okay.
But yes, I mean, there are people that see me, say, for urinary issues who might get super nervous. And sometimes when you're super nervous, you either can't get an erection or you get an involuntary one.
And then they're like, "Oh my god, this is so embarrassing. I don't feel."
It
that
is.
way."
I mean, I'm been doing this for a very long time, so I, normalize it as much as possible. I examine only the parts that I think I need to examine to figure out what's going on with them. And so, sometimes I'll make a joke about it to kind of make them feel more comfortable, and then I step out and let them get dressed, and we go on about the visit. But it does happen.
cute. And are you just desensitized? Like when you go home to your partner now, are you like, oh, not another one? Like,
No, it's very clinical for me.
Okay.
Yeah,
He
I think-
loves this, but
Yeah.
people, people love their jobs.
Yeah.
no, I get it. I'm
Yeah.
just like, oh,
I doubt he doesn't look at you, goes home and complains about the poor people that are already so embarrassed.
Oh, your partner's like, can you take a look at this? And you're like, oh, fuck off.
Yeah, no, that would say go to your doctor. I can't. Yeah.
One of the questions that we have for you is, do people have unrealistic expectations when they come in? Does somebody maybe think that they're going to go from a 4 to a 10? Or can you even do that?
So length, no, there's not much we can do for length, especially not 4 to 10. We're doing some stuff in our office now using stretching devices and injecting patients with PRP, which is platelet-rich plasma. And it's based off a trial that was done that did show an increase in length. But we're talking about, little under an inch, which for a lot of guys is significant, but it takes time. I mean, that's a 6-month process.
Wow.
But there's not really any way that you can take somebody from 4 to 10. So I think in terms of unrealistic expectations, I don't see it a lot for length because I think guys understand that they're not going to be able to grow that much. And I think there's unrealistic expectations in any area of medicine. I think people are pretty thankful that they are able to see someone like me and are just hoping that I can help them at all. And so I would say for the most part, our patients are pretty grateful for even if we can resolve their issue to like a little bit. So I'm thankful, I guess, in that most of my patients have realistic expectations. And then it's also on me to set those expectations at their first visit. I don't overpromise. I try to be very transparent about what they should expect from whatever treatments I'm recommending.
How would you suggest someone to not be so nervous so they don't wait 10 years to come in, or is that all on them? They gotta.
I think it's all on us. I mean, I think that they're not feeling like that in a vacuum. It's because of growing up in our society. And so I think it just takes time. I mean, I think like you guys were saying earlier, things are changing. CVS is carrying lube and cock rings now and even vibrators.
Everybody having OnlyFans and all those
exactly. So, and I think I'm going to age myself, but the Gen Zers are just so much more open about sex and fluidity and sex work has been destigmatized to a certain degree. And I think there's a lot of backlash to that, but there's also a lot of good for that or from that, because it allows or forces people to just become more comfortable having conversations around sex. And I think the more that happens, hopefully, and hopefully more doctors come through the pipeline like me that are really focused on this and try to normalize it as much as possible. I just think it takes people have to come to that own realization themselves.
Aesthetically, do you see a lot of stuff popping up then if people are putting their, privates out there more, or let's say for Instagram, or even just in general, people having more sex? Like, is there anything else that people do other than fillers to, like, I don't know, is there a penis facial or like laser or like laser things, or do people,
I don't know that I've encountered anybody that has done in that. And I got like a media request asking me, I think, about some sort of penis facial. I mean, it's just skin, so I suppose you could do a facial down there. I don't know that
maybe
it would
if someone's
necessarily
really dry, like if they have maybe like eczema or something. Because I'm sure that you can get eczema
it's just
there.
another, like you said, another body part. So that's covered with skin. So I think anything you could do to take care of your skin, you could certainly do down there. I would be careful. Obviously, your urethra is down there, and if you get anything irritating in there, it could certainly cause some issues. But a gentle cleanse, maybe like a Cetaphil lotion.
You can do that yourself. Exactly. Keep your penis at home and do you, because it's just shower.
Exactly.
Right. Let's not get into blueberry facials for you too.
Right.
What's the craziest thing someone has come in like, okay, so I'm trying to get to who cut their penis off? Tell me the story now. We're on the podcast. I need to know.
So that's actually a story from my my co-founder Brian, but I will share it with you because he shared it with me. So a man who had some mental health issues came in having severed his penis off. So he kind of Lorena Bobbited his own penis because he was having a psychotic break essentially.
Oh shit.
And so when that happens, it's obviously an emergency and we do our best to reattach it, but there's a lot of stuff in there that needs reattaching because it's not just putting the skin back together. You've got to put the corporal tissue, meaning like the erectile tissue. Exactly. So you put the arteries together, you try to put the nerves back together, you put the fibrous tissue back together, and then you put the skin back together.
So many little nerves.
And then the urethra, of course, because the penis serves two functions, right? It gets hard for sex, but you also urinate through it. So you've got to put together the urinary tract and the erectile bodies.
Wow.
What amazing work to actually be able to go, shit, my penis, I cut it off and I was able to have it reattached.
Please don't do that.
No, I've never thought of that.
Yes.
Like that makes me shudder just thinking of it.
I thought about, honestly, having my vagina lips fixed. But that's common. That's a common thing.
Why?
Because I have longer labia and I was so embarrassed by it in high school. And then when I actually got into the porn industry, they hyped me up because of it. So then I didn't want to do it.
All my straight
It's your signature.
They really hyped me up. And then every guy that I've been with after obsesses over it. So I don't cut them off. But it's kind of like, I thought at one point about,
Aren't you glad you didn't though?
Yeah,
It's like, isn't it funny your perception can change with someone else going, no, I really like that. That's awesome. And you're like, oh, I just hated the way that I looked.
I mean, I think that's true for both men and women's genitalia, right? We all have these weird understandings of what a normal,
it's like body dysmorphia.
Labia should look like, what a normal penis should look like. They're like snowflakes. Like no one of them is the same. They are different colors. They're different sizes. Like I think unless it's causing a functional issue, I really try to discourage, patients from doing anything to their genitals that's like irreversible. And that's the other amazing thing about penile filler is like if someone isn't happy with the results, we can inject, Hylenex and dissolve it, right? So we're not cutting a ligament, we're not putting anything, foreign in there, like any kind of device that if they regret their decision, they're kind of screwed. Yeah,
because you might just be having a bad year and it's kind of like that body dysmorphia if you were like anorexic or something. You don't see what other people see. And then the moment someone else tells you, like you finally meet someone nice that doesn't like body shame you or whatever, and you're like, oh shit, I was actually hot this whole time. That's, and actually my straight trainer did say that. He's like, no, I love that. Like when the women, he's like, it's the equivalent of a guy having a dick with like grey sweatpants on when it's a bit bigger. Like he's like the lips is like the thing that they like. Yeah, they're like
I don't understand that at all, but I think it's great.
We don't understand it.
The straight guys do love it. Some do.
Totally.
When they like it, they're like obsessed with it.
That's
It's an
great.
interesting thing.
Yeah.
One more. What is the weirdest thing someone's put up their butt that you have to? Oh, it's not really your area of expertise.
Yeah, I don't
but need to
normally,
know.
even though I've done some TikTok dances talking about things people put in their rectums, I haven't had to do that since I was a resident, so it's been a few years. I had someone, so we deal with more with the urethra, right? So I had someone, I don't know, like 6 months ago, I was on call at a local hospital here in LA, and I got called because somebody stuck a sound inside their urethra. So it's like a metal rod that
Whoa.
that is,
because it vibrates.
no. It's just like a curved metal rod that is actually a medical device that we use when someone has like a urethral narrowing. But the fetish community has used these devices as a way to like induce pleasure. And so the men will sometimes stick these metal rods in their urethra.
Does it work to pleasure them?
How
If
thick
you're
is
into
the
that,
rod?
yeah, I mean-
would the rod be
Sometimes
like?
they're thicker, but
Oh my
God.
goodness!
Yeah.
No.
Oh
but
my God.
but the problem with them is that if you don't know what you're doing or you're inebriated when you're doing something like this, if it doesn't have like something that can catch at the tip of your urethra, if you put it in too far and lose
it will
lose
just
grip,
go
it
down?
slips in.
Oh
No.
no!
And
And,
so-
that's going to pierce all your organs inside of you. I didn't even know.
Well, his problem was it got stuck, and then he was embarrassed, so he didn't come in for hours and hours and hours, and it's blocking your urethra, so you can't pee.
Oh.
So he came in unable to urinate, and the problem is that when it's too far in, we can't really get it. Like I can't stick anything in there at the bedside
My
and get it out.
gosh.
And it's even challenging to put a scope in there and grab it because it's metal. So everything we use to grab it slides right off. So we actually had to take him to the OR and cut it out.
Oh my
poor
gosh.
guy.
Yeah,
This is
so-
like.
So don't unless you're really confident in using those devices. Do not stick that down there.
No.
Yeah, and I told him when I saw him, he was so embarrassed, and I said, "Listen, I'm not judging anything that you're
Yeah.
doing
Yeah.
sexually. If you're into this,
Just don't be dangerous.
exactly.
Though.
Like, please, the next time you, well, hopefully he doesn't do it. Hope again.
Yeah.
but
He's
if
like,
he
I might
does,
try this one more
but
time.
if-
I'll get it right.
yeah.
this
But if
time.
he does, like, use a sound that has maybe like a little lip on it, so
Yeah.
that if you lose, it doesn't slip all the way in. Sort of like a butt plug, right? You want something with a
I got a
wide
butt plug
base.
stuck up my ass once.
Yeah.
Oh, really?
Yeah.
Stuck up there? How
Yep.
did you get it out?
Pushed it out.
Oh,
and it
wow.
hurt really bad. It hurt really bad.
Oh,
Yeah.
no.
Yeah, so
hurt
you always
really
want to use,
bad.
anytime you're putting something in your body,
Yeah.
right? You want to make sure that you're using, that it has some sort of base that's going to, if it does get stuck up there, it stops at the hole, right? That it will prevent it from slipping all the way in. So if you're using a dildo and
Yeah. Make
putting
sure
it in
it's
your
got-
butt,
I
make
had
sure
the
that,
butt plug had a base on it.
You were just feeling a little bit more relaxed that
the
day.
guy,
She was-
guy
she was-
went like this and
she was
like
doing
pushed
your
it, and he just went.
she was doing your breathing
And you
exercises.
couldn't even see it. My asshole was closed and it was like
Oh,
inside.
shit.
Yeah, it like
People
really
have put bigger and
swelled.
worse things up there. For sure.
Oh, yeah.
Sounding
Oh, yeah.
sounds worse. Sorry,
Yeah.
but it does.
Oh, yeah, that's way in
This-
your urethra. I don't know why what anyone would.
I
even
know.
wanna
No
look at me.
judgment, but
Yeah.
Yeah.
not for
Yeah,
me.
yeah.
Let's just say
Yeah.
that.
Oh wow!
So you have formulated a new product that we are very excited. I'm excited to try it.
Yeah,
Sell
I'm
us on it, pop star.
Pop star. So this, as I mentioned, my partner Brian and I, sort of at the beginning of the pandemic, put our heads together because we were both kind of individually seeing patients complaining about not coming enough, right? And this is something that happens to guys as they get older, a lot of times related to decreases in testosterone. Some guys who actually are on testosterone replacement or use anabolic steroids will notice a decline in their volume. And then sometimes it just happens for reasons that we don't know. And so we were getting a lot of guys asking what they could do to kind of make their loads bigger. And there's some medications that can be prescribed, but a lot of guys don't want to take a medicine for something like that. And we're like, what can I take naturally? And there really wasn't anything on the market that I thought was really reputable or effective. And so we kind of put our heads together, came up with this formula based in research that had been done in the fertility space, because another thing about sexual medicine is that there's rarely studies done around pleasure. A lot of them have to do with things like, how can you have a baby? And so all of the data that we looked at on how to increase your seminal volume was based in reproductive literature. So we put together the formula based on those studies that we reviewed and launched this product in early 2021. And it's been wildly successful, very well received. We just launched on Amazon. And it's been really exciting because this has been sort of like, it started out as sort of like a side project, like can we do this? Like neither he or I had ever started a company like this before or worked in the supplement space, and have just been really thrilled at how rapidly we've grown and how well received
A lot of happy
it has been.
customers.
Yeah, and I have patients that take it, and we have customers that we've never met from other countries that message us, who say that it's, not only increased their ejaculatory volume, but has changed the taste profile. So they're happy, their partners are happy. Some patients have even said it's helped them conceive. And
Taste one is a big one for me. Like, I don't want anything to be too chlorine-y. Like, so
Right.
taste is
Yeah.
like, that's a huge one.
Yeah.
And also the volume coming out. So like, how much is a regular amount for, say, a 35-year-old like me? Like,
So like 2 to 5 milliliters, like roughly like 2
and
teaspoons.
should we be shooting ropes or not?
It depends on the person, right? So like most younger guys can create larger volume and shoot farther, and that declines over time because of hormonal issues. The muscles that need to contract to get the fluid out weaken over time, and so as men age, the volume and force tend to go down. But we were seeing a lot of young guys complaining about like not being able to come enough or wanting to come more. And honestly, in my practice, it was born out of a lot of complaints I was getting from my gay male patients. I think gay guys are much more open about
like funfetti.
Exactly. Yeah.
So they want
I think a lot of gay guys are into cum and find it increases their pleasure when they're having sex if they can come more. And there is some evidence that larger volumes can increase the intensity of your orgasm. And so we've heard that a lot from our patients and customers also, that not only is the volume better, but their orgasms feel more intense. And so we're just really
Maybe
excited
from the
to
volume, because then it's
You
like
just
massaging.
keep-
and your muscles have to
keeps coming
contract
out.
more to get added volume out. So we've been just really excited to be able to launch a product that has helped, increase pleasure for
and actually
patients.
work.
Yeah,
you know?
exactly.
There's so
Exactly.
many that don't. They really don't work, and it's great to have one that really does.
I think what sets us apart, and we use this a lot in how we present ourselves to our customers on social media and through the website, is this is formulated by 2 Ivy League doctors. We believe in this product. It's based in research. It's not something you're going to get at a gas station. And right now we're really just selling it through the website and on Amazon, and we're, for the future, trying to strategically partner with places that are going to carry the product where they carry other products that we believe in. You know what I mean? So we're being pretty selective.
Maybe at CVS.
Yeah, I mean,
something
that would
like
be
that.
great. CVS, if you're listening,
You
we
gotta
would
get
love
on.
to-
You gotta get on Shark Tank.
That would be great. That
You
would
gotta
be
get
great.
on Shark Tank and
Yeah.
and, and
I mean,
get
I
these
Sit in front of
people
Mark
that-
Cuban and explain why he needs
Yes,
bigger loads.
yes.
Okay.
I'm sure it would be well received.
Yeah.
Honestly, I think so too. I mean, you sold me about the confidence thing. When you're like, this really helps people with their confidence, and I was like, I could really see that. Like, if that could
I
really
think our
help men.
listeners are going to love it. I'm going to try it. I'm going to
Yeah.
report back.
Yeah,
I'm very
please do.
excited. I know that we probably have a link. I can't remember what the link is right now, but we will have a link in the notes.
Yeah, the website is popstarlabs.com, or you can just search for us, Popstar, on Amazon, and we come at the top.
Amazing.
Nice.
Well, we will be reporting back all month. Thank you so much for
You will
joining
be.
us. I'm excited.
Yeah,
I'm going
yeah,
to make
please tell
everyone
us.
taste it.
Yeah.
Just kidding.
He's gonna have a lemonade stand down the street. Everybody get a taste.
sick.
Everybody get a taste.
Oh, write that down. All right. Thank you so
Thank
much for
you.
joining
Of
us.
course. Thank you.
Thanks, guys. Have a good day.
Bye, guys.